Hello, and thank you so much for joining me in today's presentation in Research and Epidemiology. We are going to look at surveillance. So this topic is a special request from Christabel Lundaza. I hope I have pronounced your name correctly. If not, you can request for another video. Let us look into today's guideline or today's objectives. So we're going to look at the definition of surveillance. We're going to discuss the purposes of surveillance. We're going to discuss the principles of surveillance. Then we're also going to look at the categories of surveillance. We're also going to discuss the sources of surveillance data. Then we're also going to discuss the sources of specific surveillance data. Then we're going to conclude by discussing evaluation of a surveillance system. So take note of how we are going to move. So let's quickly look at the definition of surveillance. Okay, so surveillance is the continued watchfulness over the distribution and trends in the incidence of disease through a systematic collection, consolidation, and evaluation of morbidity and mortality reports and other relevant data. Let us look at another definition. Okay, so surveillance is defined as an ongoing scrutiny, continuous analysis, interpretation, and feedback of systematic collected data, which can be obtained through various methods. So these are the two definitions. You can choose which one best fits you, and also just expand more in other literatures or maybe even the use of internet to find a more fitting definition. So let us move on to objective number 2. Alright, so objective number 2, we're going to discuss the purposes of surveillance. So the first purpose of surveillance is that it allows individual cases of infection to be notified and collected or noticed. So the main purpose of you identifying individual cases is also to come up with the preventive measures which are going to fit the same case or disease identified, because not all diseases are the same, therefore they should not be treated as a collective. The second purpose is it measures incidence of infectious diseases with changes, potentiality indicating an outbreak. So the incidence, you can monitor whether there is an increased rate or it is going down. Alright, and measuring the incidence rate. So when the incidence rate is going upward, so it means whatever that you have implemented is not working, or the implementive measures are not effective enough. Therefore, you as a public health nurse, or you as an RN, a registered nurse, you need to come up with new strategies to combat the disease. Then the third purpose is it tracks trends in occurrence and risk factors of an infectious disease, allowing targeted interventions. So when you are conducting surveillance, you're able to pick up on the trends, on how it's being spread, on how or maybe on which areas are mostly affected, and how the causative agent is coming up, or what are the most essential factors that is supporting the spread of this disease. So the next purpose is that it enables priority setting and planning of control measures, for example, to a particular region. Then the other purpose of surveillance is that it helps in evaluation of existing control measures. So when you're conducting surveillance, you're able to monitor, or you're able to evaluate whether the existing ones, or the ones that you have found at that particular time, whether they are effective in combating the disease, or you need to revise your system of implementation, or you need to add new things on there. Lastly, syndromic surveillance may detect emergency of a new infectious disease of public health importance. The purpose of surveillance is basically to prevent any harm or any spread of a disease to the general public. So the control has to be established before. A good example that I can give was for COVID. So we people who are under I would say public health, or public health nurses, had come up with ways in which they can reduce the spread of COVID-19, since they had understood its mode of transmission. They had also understood the causative agent. Then they came up with vaccines to help combat the disease. I hope that's clear. Then if you're not clear, you can leave a comment down in our comment section. Let us now look at the principles of surveillance. So the principles of surveillance are as follows. So a good surveillance system requires a case definition which includes clinical or microbiological criteria. So that's number one principle. Definition under, case definition requires that you describe the disease in its entirety, or should I say, you give a full description of what it is. Then clinical presentation, at least you're able to identify the signs and symptoms. Then under microbiological criteria, you're able to identify the causative agents. Moving on to principle number 2, the case definition must be sensitive enough to detect cases that, the case definition must be sensitive enough to detect cases, but also specific enough to prevent too many false positives. So different levels of case definition are often used to describe a case with increasing specificity, for example, possible, probable, and confirmed, or dependent on the confirmatory clinical and microbiological data. What are they trying to say about thin shift? So when you look at this reading, or should I say this principle, when you're conducting a screening procedure, in order for you to detect those who might be infected from those who might not be infected, the results must be accurate enough not to produce results actually accurate, or should I say results fake. So they have to be very much accurate in accordance to what you need, so that you know how many are affected or how many are not affected. Then when you look at something being false positive, so we are trying to eradicate any human error where you give somebody at nad wala but in start bed. So that's what we are basically trying to rule out here. Then the third principle is several surveillance systems with differing levels of sensitivity and specificity may be used in combination to provide multi-facilitated information aspects such as burden, high-risk groups, and laboratory confirmed characteristics such as antimicrobial susceptibility profile. Then the other principle states systematic collection of data, so systematic, regular, and uniform. So you have to follow a pattern. That's what this principle is basically talking. You cannot skip one. If you cannot start from level 4 then move back to number 1. So you have to follow a line of a chain of doing your routine. Guys, so pardon me there. Then the other principle is analysis of data to produce statistics. So these statistics basically need to include time, place, and person. So when you identify the time, the place, and the person, you're basically identifying trends, and you're able to come in between and establish more control measures. Right. Then the other principle is interpretation of statistics to provide information. So this should be done. In a timely manner, and it has to be complete, and representation has to be done. So why are we doing interpretation? We want to understand what we have and how we can come in as health workers. Alright, another principle is distribution of this information to those who require it for action. So who are those people that require it for action? So this includes healthcare practitioners. We are also looking at communicable disease epidemiology reports. So these are basically even CDC, or should I say other other established entities that also deal with anything related with outbreaks. So not only working in isolation but also working hand in hand. Lastly, continuity is needed to evaluate actions taken. So it has to be done in a continuous manner, or should I say process. So it should be continuous and stating before you finally work or before you finally implement the control measures and see that there is a reduction in either the spread or the level of infectivity. Let us now look at the categories of surveillance. So we have quite a number. So let me first give you a list. So we have active surveillance, passive surveillance, syndromic surveillance, sentinel surveillance, enhanced surveillance. Alright, so let's begin with active surveillance. So active surveillance requires that there is special efforts to collect data and confirm their diagnosis to ensure more complete reports such as surveys and outbreak investigations. So this encompasses formal and informal communication such as phone calls or internet searches to seek information. Another example that I would add is when health workers go into the community to dig out this information. So they're trying to find out whether the communities are aware of an outbreak or they want to see the sources of where this outbreak might have occurred. An example would be the recent case of cholera. So it's not only limited at the hospital level, but these health workers also now go in communities and other established where you can find at least around. Okay. Then let us move on to the other one, which is passive surveillance. So the use of routine sources of information such as notifications, laboratory reports, hospital episodic statistics. So this is mainly done at the hospital level. There is no movement whatsoever. It's only dependent on what the health provider or the healthcare system at that particular time gets from the patients who are either inpatients or outpatients. All right, then syndromic surveillance. So when you're looking at syndromic surveillance, okay, so this allows for earlier detection of outbreaks or health threats than would normally occur using traditional notification systems, and therefore it will to implement actions that are needed to the targeted audience. Then syndromic surveillance, like the name states, are basically looking at the specific signs and symptoms and what they're presenting cases that are there at that particular time. Let us now look at sentinel surveillance. So sentinel surveillance, these systems facilitate syndromic and routine surveillance rather than collecting data from all notifying clinics. So only a sample are asked to report data at a regional or national level on a regular or weekly basis. So for example, weekly or monthly basis. Then lastly, we have enhanced surveillance. So enhanced surveillance is a collection of data above the collected or routine surveillance. Let me repeat that. Enhanced surveillance is a collection of data above that's collected for routine surveillance. So generally at a patient level and often to design or evaluate an intervention or to aid control of more important health hazards. So for example, gaining epidemiological reports as well as microbiological information about bacteremia cases in order to target and evaluate the effect of healthcare interventions on the incidence of infection. So there are quite a number. These are not the only categories or the types of surveillance. Again, take note, categories can also mean types. So in case they ask you my types, don't be blank. You have heard it from here, you have read it somewhere else. These can be applied there. Let us now move on to the next set of objective, which is the sources of surveillance data. Alright, then When you're looking at the sources of surveillance data, we have number one, statutory notification, number two, laboratory reports, three, serological surveillance, then number four, sentinel reporting systems, routine, primary, and secondary care utilization data. So this can be in hospitals or clinics. Number five, we have death certificates. Six, enhanced surveillance for infectious of public health importance to combine epidemiological and microbiological data. Then seven, vaccine use. Then eight, sickness absence. 9, epidemiological reports. 10, media reports. 11, social media activity. 12, animal survey and vector studies. 13, spatial systems. Then 14, mortality data. Then 15, laboratory reports. Then lastly 16, hospital surveillance. So these are quite a number of sources. I'm sure there are more. Then we're going to now look at the last segment of surveillance, so which is the key attributes of the surveillance system. So we have number one, simplicity. Number two, flexibility. Third, we have acceptability. So it's able to relate to public data and also find easier way of data collection. Then the fourth one is sensitivity, so ability to detect health events. Number five, timelessness. Six, representativeness, pardon me. Seven, other attributes of a surveillance system include completeness, consistency, and impotency. So this marks the end of today's presentation. I genuinely hope you have understood one or two things. So thank you so much for joining me as usual. See you next time in our next presentation, and have an amazing day and all the best with your upcoming exams.